yours.
Thank you very much, Abigail, and thank you very much, Clémentine, for supporting us in organizing this afternoon session. So my name is Frédéric Destrebec. I'm the Executive Director of the European Brain Council, who was tasked to conduct this thematic network towards an EU coordination plan for the brain. And without further ado, I'd like to invite the President of the European Brain Council, Professor Suzanne Dixon, to provide a word of introduction. Suzanne, over to you.
Yes, thanks a lot, Fred. It's great to be here. So as you heard, my name's Suzanne Dixon, and as President of the European Brain Council, I warmly welcome each and every one of you to the first webinar of this European Brain Council-led thematic network called Towards an EU Coordination Plan for the Brain. So just to tell you a bit about EBC, we're a network, the European Brain Council, we're a network of players in the brain area, and we have a very broad membership encompassing scientific societies, patient organizations, professional societies, and also industry partners. We aim to speak with one voice, and the EB stands therefore as a platform that fosters cooperation between member organizations and other stakeholders, consistently promoting dialogue between scientists, industry and society. As showcased by its growing portfolio of projects, research and policy papers, as well as events, the European Brain Council emphasises the importance of continued interaction with the European institutions to build strong European health policies, raise awareness and encourage education on the brain and the repercussions of neurological and mental health conditions on society as a whole. The European Brain Council has been selected to lead the DG Sante Thematic Network titled Towards an EU Coordination Plan for the Brain under the EU Health Policy Platform. With this thematic network, our primary aim is to prepare a position paper, which we refer to as the joint statement, which will present the collective vision and strategic recommendations towards an EU coordination plan for the brain. This statement will also socialise the notions of brain capital and brain economy and reach a consensus on how pivotal they are in addressing the current social, economic, demographic challenges and improving EU citizens' health, with a focus on prevention of non-communicable diseases. So this is our first webinar. We have some aims. We want to discuss the state of play when it comes to brain health, research and innovation in the EU, number one. Number two would be to identify challenges and opportunities to work towards a comprehensive EU coordination plan for the brain. Thirdly, to develop a joint statement, super important, by engaging with the wider brain health research and innovation community. And fourthly, to lay the foundation for a collaborative platform to develop strategic recommendations for enhancing brain health policies and practices across Europe. Thank you for being here, your participation, your interest and engagement. Stay tuned, and on that note, I think I would like to hand the floor back to Frédéric Destrebec, our Executive Director at the European Brain Council. Fred.
Thank you very much, Suzanne. I think you've laid it out beautifully in terms of what our objectives of today were, and also in taking over from you, I'd like to remind everyone that we are engaging into a process that is leading us towards the end of November, when the joint statement will need to be released and presented at the European Policy Platform main conference. It will be on the 26th of November, to be precise. So we are actually proposing today the first session and the first engagement opportunity here online via this webinar. But it's very important for us to emphasize the fact that the consultation will be an ongoing one, and we are really aiming towards the mid-October to be able to collect your input and the input of your organizations in order to feed into the different components of what the joint statement is going to look like. And the idea being that this first webinar really opens that process of collection of input. The second webinar is planned, and we have had confirmation of a date. You can already mark your diaries. It will be on the 24th of October. And our objective is that on that date, we would present to you the content of the joint statement on the basis of the consultation that will have been run in the meantime. The idea is to validate this draft statement towards approval by mid-November in view of the presentation at the end of November. So as you see, this meeting today is really important in this process, but it's not the unique occasion for you to contribute. So please do spread the word to colleagues or to like-minded organizations so that they really feel they have a chance to step to these discussions. So I'd like to open now and turn to our first panel and inviting our panelists to join us. I don't think that Orla has connected yet, so maybe Leo, I will turn to you as our first contributor. Leo, you are a board member of Gamian Europe, the Global Alliance for Mental Disorders, and a member of EBC. And we would like to invite you to open this panel on under the topic of challenges and urgent needs in the field. And obviously in doing so, we are eager to provide, let's say, the first word to our patient organizations. So Leo, over to you.
Thank you. Can you all hear me okay?
Yes, if you can speak slightly more loudly or closer to your microphone, that would be superb.
Will do.
Perfect.
Okay, I am Leo Finn. I'm British, but I've lived and worked in the Netherlands for over 30 years, and I'm a board member of Gamian Europe. Gamian, as already explained, stands for the Global Alliance of Mental Illness Advocacy Networks, and we're an umbrella organisation representing the views of mental illness patients associations from across Europe, from Finland in the north to Greece in the south, Portugal in the west to Romania in the east. We speak for the patients. On a personal level, I'm not a health industry professional, nor am I myself a mental health patient, until now at least. My contact with the world of mental illness has come about through dealing with friends and family members who themselves do suffer from conditions ranging from schizophrenia to depression and autism. In this context, it's perhaps wise to remember that according to the World Health Organization estimates, approximately 25% of the population is likely to experience a mental health crisis within their lifetimes. My own personal interest is in the speedy and accurate diagnosis of mental health problems at an early stage. There was a case recently reported of a young teenager with a preliminary diagnosis of autism having to wait 2 years for a formal diagnosis, during which time no support or schooling or treatment was available. This is not acceptable. Not only has this child lost 2 of the most formative years, but the family has also had to deal with the burden of additional stress, raising the risk of themselves developing mental health problems. Now, while it may be recognized that most of such shortcomings have come about due to insufficient funding, recent events such as conflicts and the COVID pandemic have increased the incidence of mental health problems and placed the existing structures under increased pressure. Now, some efforts have already been made to promote the idea of brain health. See the links below to Gamian's top tips for supporting your brain health and Brain Awareness Week of 2024. But more needs to be done. By raising awareness of brain health as a concept, couched in terms of economic potential, we stand to gain from additional funding, being able to help mitigate the worst effects of mental illness on society and the loss of brain potential. I can be contacted at Gamian. The link was shown below in the notes, which will come through. And if you have any questions, please don't hesitate to contact me. Back to you.
Thank you very much, Leo. That was really crystal clear and a very important contribution in opening this this panel and this session. Actually, in complement to your perspective, I'd like to invite not Orla, who provided an apology, but Tadeusz Avrot, who is standing in for EFNA, the European Federation of Neurological Associations. So, Tad, you have the floor.
Thank you, Fred. First of all, apologies from Orla Galwin, EFNA's executive director. She's been trying to connect for the last 20 minutes, but her computer reboots every time she launches WebEx, so she apologizes. So I stand for her, representing the European Federation of Neurological Associations, where I'm a senior policy advisor. I want to start by congratulating the European Brain Council for launching this network. I think this European work showcasing brain health is long overdue. So a few words to set the stage regarding neurological conditions. Perhaps not everyone is aware that the neurological conditions are a third leading cause of deaths in Europe and equally a third leading cause of DALYs, which is disability adjusted life years. And just a few months ago, actually, there was a new paper by Lancet Neurology, which revealed that globally, neurological conditions affect over 3 billion people, not million, but billion people. So I think we are speaking about a degree of challenge that can only be addressed at the European level in Europe. EFNA in 2022 conducted a survey on access. We know that in general we have issues. There are huge access inequities in Europe in all therapeutic areas, which is why we are now revising pharmaceutical legislation. But more specifically to neurology, we learned in the survey that only 1 in 5 of those living with neurological conditions have access to affordable therapeutic interventions. So these are the issues, but we also have a number of instruments where we can actually start discussing the solutions. And one of them is a WHO Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders 2022-2031, which was launched a couple of years ago. And the IGAP, that's how we call the plan, is providing concrete solutions and also having specific targets and indicators that all the countries are committed to, and this includes Europe. So what I really want to stress here is that we should be really connecting these different areas. We have the Global Action Plan, we have obviously now the upcoming Brain Health Partnership in the research domain, and finally we have Healthy Initiative, the NCD, Healthier Together NCD initiative, where there is a strand on neurological and mental health conditions. And it seems to me that it's a great opportunity to start connecting the dots and working together and having the EU taking the lead to help European countries address the huge burden of neurological and more broadly brain health conditions. Thank you.
Thank you very much, Tad. And actually, you're already teasing for the later part of our agenda, where we will be speaking about the Brain Health Partnership and the NCD initiative. But I can only echo your comment about how today's event and the entire initiative under the thematic network is actually aimed at connecting those dots and those little achievements that we should actually seek to weaving together into this broader vision. So thanks for that insight, and we'll certainly come back to some of the points you've been making, like for Leo. I'd like to turn now to our third panelist in this introductory panel, Professor Thomas Ryan. Thomas, you're professor at Trinity College in Dublin, but you are also very actively engaged with FENS, one of our founding members, the Federation of Neuroscience Societies. So we've heard from Leo and from Tad the patient perspectives about the urgent need for action in relation to the burden, delayed diagnosis, lack of access, but we also wanted to have your contribution so that from the perspective of basic neuroscience, you could also try and help us identify some of the core challenges as to how addressing brain health and brain disorders would come about. So Thomas, over to you.
Thank you very much, Fred, for the invitation to this event. I'm representing President Ole Klein of the Federation of European Neuroscience Societies. I'm also a member of the Government and Public Affairs Committee of the American Society for Neuroscience. So FENS as a body, we were formed in 1988. We represent 44 different neuroscience societies across Europe. That includes national societies, but also specialist sub-interest societies. In total, we represent about 22,000 active research neuroscientists across Europe. And the Society for Neuroscience in America, we represent 36,000 active research scientists across the world. We greatly support at FENS what the European Brain Council is doing to promote this thematic network towards a European coordination plan for the brain. And the reason for this we can all agree on: brain health disorders, including neurological disorders and mental health disorders, are costing us over €1 trillion per year. So we fully endorse the platform of no health without brain health. We would only emphasize on top of this that there is no brain health without brain research. The reason we say this is because, of course, everything we currently know about medicine, about brain health, came from scientific research. But the brain currently is quite different from all of the other organs that we study in biology and disease, for the simple fact that we don't know how it works. Unlike the heart, unlike the kidneys, we still don't have a comprehensive understanding of how the brain works. And so we're not in a position to be as targeted as we would like in order to develop novel treatments, more effective treatments for neurodegenerative disorders, for psychiatric disorders, for rare diseases that affect the brain, and indeed for the increasing public health cost that is being put on the brain by long COVID and by the COVID-19 pandemic. I've been asked to describe different barriers that we feel currently exist for brain research in Europe, and what are the kind of things that can be done to improve this. And I would briefly describe these three different barriers into three different categories. One is funding, another is animal research, and the third is recognition of basic neuroscience in Europe. That includes at a European policy level, but also with respect to national governments. I think what crosses across these three issues is an assumption from wider society that science has everything it needs to do its job. And the reason for this is, of course, because science has been incredibly successful. But I would say that most of the success of science has been in spite of, rather than because of, the support that we get from society. Because apart from certain epochs in the 20th century, scientific research in every country tends to struggle for funding and for attention. And that's partly because scientists don't always make enough of an effort to present ourselves and to make our case to society. And that's partly why the European Brain Council is so important in Europe for this purpose. I'm just going to drill down into what I mean with respect to funding, first of all. And I would say there's three issues about funding. One is funding levels, the other is funding mechanisms, and the third is funding harmonization across the European Union. With respect to funding levels, I think we have a positive control, or a good example, for what we would consider to be success. And that is American neuroscience. It's not perfect, but it's the most developed neuroscience ecosystem so far in the world. The United States pays 36 billion tax dollars per year to the National Institute of Health, which is most of the biomedical research in the public sphere in the USA. And about a third of that budget, 12 billion euro annually, goes to neuroscience and brain health disorders for research purposes. That's 12 billion US tax dollars per year. In Europe, we don't actually know exactly how much we're spending on basic neuroscience research because there are different mechanisms at national and European levels. At a European level, we know that Horizon funding accounts for about 500 million euro per year of neuroscience investment. And that's out of a total budget of 95.5 million, which of course goes beyond biology and beyond science. So it's hard to give an exact proportion of how much of our biomedical budget we're spending on neuroscience. But it's certainly not prioritized in Europe as much as it is in the States. It certainly is not 1/3 of our biomedical budget in any European country. This is obvious from the number of active neuroscientists and also the number of neuroscience publications that are produced. So the first barrier is general neuroscience funding levels, and I think we'd all like to see it increase, because I think the next 20 years is going to see huge developments in neuroscience. I'm extremely hopeful as a mid-career neuroscientist in what we can achieve in the next 20 years because of the new tools that have become available in the last 10 years. So I think we're going to see huge strides in neuroscience, but the question is, will that happen in Europe, or will that primarily happen in other countries? And I would add that the rate of increase in neuroscience investment is far greater in both the USA and in China than the rate of increase in brain research funding in Europe. The second, briefly, is funding harmonization. We fund neuroscience very differently in different member states. This affects mobility, it affects recruitment, it affects career coordination, particularly amongst younger researchers. And I think we'd like to see efforts to make a more sort of straightforward and homogeneous in a good way, research funding infrastructure across Europe. Part of that would come from the European level. Part of it could come from different funding agencies in different countries talking to each other. The third aspect of funding is we'd like to see more, I think, institutional support. What makes European institutions sometimes different than our American counterparts is that the core facilities for doing research, and this is a very boring problem to raise, but aren't quite physically what they might be in places like North America. And that means that individual neuroscientists spend less of their time doing the actual science and more of their time maintaining the place that they work. So having more of a focus on infrastructure in Europe at a physical level, I think would help. Moving away from funding, animal research ethics is becoming increasingly restrictive in Europe, and in a very different way in different countries. And this is because of how different countries are interpreting the same legislation, because we're all working under the same European animal legislation. But some countries are interpreting this in an overly conservative way, in some ways inhibiting neuroscience research or driving it to other countries or other continents. We find that when you engage with policymakers on this, such as the CARE Committee at FENS, which does this quite a lot, it's very much like pushing an open door. When policymakers listen to our problems on animal research, they want to help right away. It doesn't cost any money. It's just literally about removing barriers. But they don't hear from us if they don't hear from us. And this is currently becoming an increasing anxiety for people doing brain research in Europe. And the last point is simply recognition of basic neuroscience as a fundamental component of brain health, but also as being as a priority for society in general. When you talk to congressmen and senators in the USA, many of them are aware of brain research as being a priority. They're very focused on Alzheimer's and dementia as being a growing problem for the American working population. And it feels to many of us that in Europe and in most European member states, there isn't the same awareness of this as being a priority. And we have to still spend a lot of time talking to policymakers on the introductory aspects of things to bring them up to speed on the problem before we can get them to listen to the proposed solution or the proposed asks. And that's really our own fault. You know, that's not something that I want to be putting out there as a barrier that's been imposed on us, but it is a barrier, and it's one that we need to push through organizations like this and through joint statements like this. So that's all I wanted to say for today, but I'm happy to engage more on any of these issues during the discussion period. Thank you very much.
Awesome. Thanks a lot, Thomas. This was really thorough, but quite a few of target points that we can come back to. Tad, I've seen that you've raised your hand, but I wanted to bring you back as well as Leo in the conversation, because there is, to me, one element that Thomas has emphasized in his various points, is this connection between science and society. To put it as an abrupt summary, but it's the way by which science is being regarded as still being able to address the challenges that we are facing as a society. And I mean, the two of you have been very precise in exemplifying the burden of disease and the lived experience of people living with a brain condition. How do you think we could foster this reconciliation of looking to neuroscientists as being able to respond to those needs? So Ted, would you like to start on that?
Mm-hmm. Yeah, well, I think that the more we move from the kind of clinical setting, the more that we risk to have a disconnect between the scientific pursuit and the actual needs of people with lived experience. So I think, and you know, this also applies to things like digital technologies and so on. So I think that the more we move away, the more we have to make sure that there are mechanisms in place whereby patients' voice is really kind of firmly put and not just as a kind of a consultative voice, but really having patients involved as early as possible. And I also very briefly wanted to speak to Thomas's kind of unflattering transatlantic comparisons. Indeed, we have a good idea about the amounts of funding going to health from Horizon Europe, but actually we also have an idea about what comes from member states, because the EPRS, the European Parliament Research Service, made some estimations about the EU's collective public investment in health R&D. And collectively, so bringing together member states and EU money, we are speaking about around 11 billion euro of health R&D investment per year. And when you break it down, member states governments allocate something to the tune of 9.7 billion, and then the remaining, which is 1.18 billion per year, is coming from Horizon Europe.
So I would spare ourselves the discussion about exact figures, but Thomas, if you'd like to respond, I know that you have a hard stop at 35, so maybe if you want to have a quick response to that. But it's definitely something we can leave for later, and we are not going to resolve this afternoon.
Yeah, no, I mean, well, I believe that's the total health budget, which is still much larger in the US. I don't think we know the brain research budget from member states, because that has not been calculated per EU member state. I would love to know the figures if someone has them currently. But I think that due to differences in funding mechanism, we don't actually know the exact figure.
But let's say that regardless of the quantity, I think that what you were saying, Thomas, about 1/3 being dedicated by the NIH to neuroscience.
Yeah, I think it's quite remarkable that the NIH do produce 1/3 of their budget on neuroscience, and that's in addition to their funding of core institutes that also fund neuroscience research in the NIH. Because we're only talking about extramural funding, which is the 12 billion euro a year is essentially funding that they give directly to university investigators. It's in addition to their core funding of research. And it really does show the prioritization on neurological disorders, degenerative disorders, and neuropsychiatric disorders, because they have an increasing burden on us as we get older. They have an increasing burden as we go through life, and they're going to be a significant cost, incidentally, of the pandemic. And I think that in one of the reasons that this happens is because there have been a lot of policymakers on both sides of the political spectrum in the US who've been very, very aware of having an aging population and can connect up the dots between how this is going to feed back onto the workforce and the cost to the taxpayer. This has really been visible going back to the 70s and the 80s. And so I think that that's something that we quite haven't acquired in our public consciousness for the relationship between science and society in Europe, which is the question. in that it seems to be a relationship that we need to make more circular. We want certain things out of science, quite rightly, for the purpose of brain health, but we need to provide science with the means to do that.
If I can just add a point here.
So, Leo, I wanted to circle back to you, so please go ahead.
Yeah. Now?
Yeah, go ahead.
Okay. I think one part of it possibly is the fact that the European society in general is perhaps not so well informed, question mark there, which puts it to be primarily a problem of PR, that the neuroscientists need to improve their PR in the European market to to be able to put their points across. There's, even at a more basic level, we have problems in Europe explaining what mental illness is. So trying to explain the ins and outs of neuroscience is going to be even more of a problem. It's education, and awareness is the first step. You make people aware that there is a problem and what that problem means, and then you can start to educate them. Once you have them educated, then they can ask the right questions, and then you get the right feedback. So I think there's possibly an element there. I don't know for certain. It's just a gut feeling, basically. I mean, we also do find, particularly within Gamian, that we get flack from the public or even the industry, if we try to take part in a research project which involves one of the pharmaceutical companies, because we are involved with the pharmaceutical companies. Now, this is a case of bad PR, because the pharma industries have had bad PR in the past, and there's basically a hangover from that people distrust the big pharma. But that's primarily a PR problem as well, which you've got to handle from the mental illness point of view.
Yeah, but there is definitely an ongoing need as to defend the collaboration within all the tiers of the ecosystem, as we call it. Thomas, if you have to go, feel free to pull out. I understand you've got a plane to catch, but it was lovely to have your contribution. We'll be moving on with the conversation, and we look forward to maybe exploring those points further as we go in the process of the joint statement. Tad, maybe I wanted to turn to you for a word of conclusion into this panel, particularly as there was a question from Anna Ökvist from Sweden, asking, what is the level of understanding and the level of agreement of having brain disorders, brain health being, let's say, singled out as a common term or common umbrella for action. Again, it's probably not something we can solve today, but re-emphasize a few of the talking points here. To you, Tad.
Thanks. Yeah, I'm a kind of vivid advocate of talking about brain health rather than kind of atomizing ourselves too much in different areas. Of course, there is space for this, but I think overall we see it, especially with basic neuroscience. Brain is one, and when you research the brain, you don't necessarily see that this is mental, this is neurological, this is neurodegenerative. It's becoming a little less obvious the more you go to actual care, but I think we have a lot to gain in the field if we look at the brain horizontally, because one of the reasons why this area was not sufficiently prioritized for so long is that it was very atomized. For instance, in neurology, people were looking separately at epilepsy, separately at stroke, which was earlier classified as cardiovascular disease, brain tumors, and so on. And the burden was also quantified separately. So I think that certainly there is strength in coming together and looking at the brain in a more holistic and comprehensive way, something that EPC has been doing for 2 or 3 decades now, I suppose.
Thank you, Tad. And I'll thank you and Leo also for your contribution. Probably we can wrap it up now and move on to a program as the clock is ticking. And please feel free to come back into the discussion as the meeting progresses. I'd like to maybe turn on to our friends and partners, Professor Haris Ayer and Professor Rim Ayadi, to open our next panel about the strategic opportunities on how we can move the narrative around brain health, brain capital, but as it was mentioned earlier, the brain economy. Haris, you're the director of the Brain Capital Alliance. You have been proposing quite a few of these concepts. And Rim, you're coming here as the president of the Euro-Mediterranean Economist Association. So I'm happy to give you the floor.
Wonderful. Let me go first and then hand the microphone to Rim. Rim, is that okay with you?
I think we can work that way, Haris.
Okay, great. So it's good to be here with you all. I am speaking to you from the United States, so I'm glad to be here with my European friends and helping out as much as I can. So we're very interested at the Brain Capital Alliance, at the Euro-Mediterranean Economists Association, and at Rice University in Houston, Texas, in advancing the brain positive economic transition. It's really a way of making neuroscience deeply applied to society through each individual sector. And our goal is to empower the brain area stakeholders to get involved in really cutting edge economic and social issues. So we recognize that the current economy is brain unhealthy. I think we can all agree with that. The cost of mental and neurological conditions around the world is about $2.2 trillion in healthcare costs and lost economic productivity costs. And that is rising. So that is really concerning to us, that the current economic model that we live in, the current societal model, is evoking these brain unhealthy responses, manifesting as these types of mental and neurological conditions. And that's issues across the lifespan. So these issues are certainly impacting our economic security as nation states. They are impacting our ability to educate our children, for our kids to acquire skills, for adults in the workplace to upskill and reskill. So this is a profound impact on our economy, and that's beyond the sort of humane and moral issues that we see as well. So what we're looking at is an economic transition, a system-based change. How do we go from a brain unhealthy economy to a brain healthy economy? And we're looking at the model of the green transition. The current economy, you could say, is not green. You know, our energy systems are based on coal and oil and gas based energy. Our approach to building materials and food systems is all very carbon emitting. So the green transition that Europe is pioneering is all about shifting that. How do we go to clean energy sources? How do we go to much more carbon unintensive ways of developing our food and such? And that green transition requires public sector to be involved in facilitating this, or regulating, requires the private sector to be involved in advancing new technologies, requires philanthropy to be involved as well. And we look at the great example of the European Investment Bank working with Bill Gates as an example of a public-private philanthropic partnership around breakthrough energy. And when we think about the green transition, we think about science and tech, we think about workforce, and we think about investing and regulating. So this model that we're talking about today, going from a brain unhealthy economy to brain healthy, that is all about the same thinking. What is the role of the public sector, the private sector, philanthropy? What's the role of research, basic research, startups, investing, and regulation is, regulating things like Parkinson's inducing pesticides or social media. So that is the brain, what we call the brain positive economic transition. It's about going from an economic model right now that's depleting our brain capital, our stock of brain health and brain skills, to going to a new economic paradigm that builds brain capital. And the final point I'll make, and then I'll hand to Rim, is to say that this brain positive economic transition, we believe, is foundational to these other economic transitions. Europe is going through a digital transition where we have AI, for example, sweeping across every nook and cranny of society. We're going through the green transition. These are all skill-based economic transitions. They require highly educated kids, and they require more educated adults, and adults that can upskill and reskill. And so we don't have a chance of achieving these transitions unless we have this brain transition that allows us to be brain healthy, to be learning, to be adapting, to be resilient. So this is the context of the brain economy transition, and we I personally am very committed to supporting Europe as we try to articulate and refine this model. And maybe I'll hand it over to Rim now to say some remarks from her perspective as an economist.
Good afternoon, everybody. Thank you, Harris. Thank you, Fred. Do you hear me well? Because I'm having some challenges.
Yes, we can hear you perfectly.
Yes?
Yes.
Perfect. So first of all, I want to say that this is a great and a very important conversation, thinking about how to coordinate a EU plan for the brain. It must be really at the heart, in fact, of the discussions that are happening in the next in the next program of the EU. So my view, I'm an economist and professor of financial systems, and my core concerns over the years is to think about how to allocate the resources into inclusive and sustainable and prosperous economies. So starting from the brain, and I think brain health, it's a core for this construction, and it must be a core for this construction, and this also what brought us together with neuroscientists, with public health policy experts and other disciplines, really to think how brain health, brain capital, brain economy, and brain positive economy particularly should all together interconnect for a system change, particularly a socioeconomic change, which will allow our economies to thrive and to ensure that our brain remain healthy over the life span. So in fact, such a plan, in my view, which is anchored, I would say, into brain health, is not only about a healthcare issue, and I think we need to be aware of this. It's really fundamental to economic growth, social resilience, and long-term prosperity for our economies. In fact, as economists, we always assumed that an economic agent, is brain healthy. But in reality, we assumed that over the life cycle, and we never changed this type of assumption. So nowadays, we need to rethink that we are endowed by brain capital, which is an asset, which will allow us to prosper over time. So really this static idea of being agents, socioeconomic agents that are only utility maximizers, have to change. And we need to rethink our assets individually. And then all what we do in our economic and social systems will have to enhance such a capital we have. So in my brief comments, I would like to connect different themes, which Harris has already alluded at and shared with you. And it was also the basis of work that we have done together with the teams, as I said, multidisciplinary teams of economists, public health experts, and neuroscientists over those years. And we've been working really brain health, brain capital, brain positive economy, and the principles for this, and a system change and also the necessity to invest strategically in these areas over time. And this, of course, it's departing from brain health. So brain is really a core of economic, I would say, of human potential, which is essential for the economic value that we are creating, because it really shapes how we think, how we learn, how we innovate, how we work, how we engage with the world, actually. And this is not only about the absence of disorders, it's also about how to keep our brain healthy over the lifespan. So it has different factors that we need to work on. And this is, in fact, brain health has been overlooked in broader economic and policy discussions. It's only about the absence of disorders, and actually the data also shows that there is only data about absence of disorders, and we don't see really how the brain should be could be healthy, and how it could remain healthy over the lifespan. So if we have a poor brain health, in fact, including mental health disorders and neurodegenerative diseases, this would lead, of course, to immense social and economic costs, and somebody has to pay for it. And then, in fact, those costs are becoming growing over time and becoming bigger and bigger. And I think over time, our systems will not be able to cover all those costs if we are not having the systems, preventive systems, to ensure that our brain remains healthy over the lifespan. So in fact, if we look at the trends and aging trends and longevity trends, we are seeing that we are bound to more health disorders, brain health disorders, which are in fact leading to some cognitive decline. And we even see that this will have implications on our economic system and social systems, and even on the ratings of the countries. And this has to be avoided if we have a complete different view and placing brain health in the center of our economic concern. So not to delve further into this, as we move forward, it is clear that enhancing brain health across the lifespan is essential to ensure that all people, all individuals, which are also economic agents, fully contribute to the workforce, innovation, and society, while they are ensuring that their brain health remains healthy over the lifespan. And then if anything that can be done, it can be treated. So, of course, we need to ensure that there are further innovations and in the areas of neuroscience and medicine and so on and so forth. So this leads us, in fact, to the concept of brain capital. Brain capital is the cognitive, emotional, and social resources that, in fact, drive our economic growth, innovation, and societal progress. So it means that not only we need to have a healthy brain, but we need to ensure our cognitive, emotional, and social resources are interacting to ensure that this brain capital increases and it becomes an asset for all the countries. So, in fact, in a world that increasingly relies on our creativity, problem solving, critical thinking, adaptability, resilience, and these are all brain skills, which are a pillar of brain capital. So we have the brain health and the brain skills, which are interacting to create the brain capital and asset. It's becoming a very important asset for our economies and organizations. It means that for example, some investment funds already, they are putting much more money on happier workers, which eventually they have much higher brain capital because they are also taking care of their well-being and so on and so forth. And this will increase the value of our organizations and of our economies overall. So it's really how well we can improve this context, not only from brain health perspective, but also from brain skills perspective, and the two pillars interact to enhance the brain capital. So, of course, when we talk about capital, we need to value this brain capital. How to value this brain capital? There are, of course, mechanisms and methods to do it, and we need the data for it. So the data will allow us to in fact, put a number on brain capital, and then we are able to assess how to improve this brain capital with, for example, proactive measures, how to ensure that our education systems are interconnected to this new philosophy, and how to ensure that we are improving our cognitive development in the lifelong for all the populations. So, for example, if we look just at the workplaces will have to support mental well-being and creative thinking, for example, and then, of course, all this needs some policies to promote brain health across the stages of life. So it's really a comprehensive view beyond brain health, but also brain health, because we need to maintain brain health in fact, over the life span. And then, of course, brain positive economy, and this is what Harris mentioned. I think brain positive economy recognizes that cognitive well-being and mental health are essential drivers for productivity, innovation, and social cohesion. So it means that we need to work toward that objective and ensure that a new economic paradigm is also not only measured via financial growth or economic growth, but also through the quality of life, the creativity, of a nation, also the cognitive health of the citizens. And this all, in short, what could lead us to well-being and wellness economic model, which in fact puts brain health, health of people, and also people in the center of the economic construction. But for all of this to happen, we need a system change. A system change will allow us to reshape our thinking, so not to go beyond the silo approaches and work together, healthcare, education, public policy, finance, economy, employment, social support, social care, in an era of digital transition, because let's not forget that we are also leaving an era of transitions. One of those transitions is a digital transition. So in fact, building environments to foster brain health, reduce stress, uncertainty, promote long life learning and cognitive resilience, it's what we need to move forward to do. And it's not about really tweaking existing systems, but we just need to transform them to be much more inclusive, sustainable, less silo-oriented, innovative, and well-being oriented. And I think when we manage all of this, so working together collectively toward this approach, is to ensure that we are allocating resources, financial resources, and we have great collaboration now with the European Investment Bank Institute, and they are really working with us toward this this philosophy, this paradigm. And of course, all of this cannot happen only one group working together, but we need to work all together to ensure that we are reaching this objective. And I think a EU plan that would connect those dimensions would be a great thing. Obviously, to guide investments, to guide resources allocation, we need data. I mean, data on brain health, on brain skills, on the interaction between those. And at the Euro-Mediterranean Economists Association, also with the Brain Capital Alliance, we worked on the Global Brain Capital Dashboard. And this is all will guide our thinking toward, the process we want to reach. And of course, this will allow us also to track brain capital across countries, to also understand what is needing, of course, to see what is the data that is available. And in fact, at the end, we are trying also to develop this brain economy lab, since we have the data already in certain countries, and work with all the national brain plans to ensure what has worked, what is not working, and then really try to find the opportunities to do more at EU level and also at the global level. So we are connecting with the UN General Assembly, and also we are working with the Africans within this Yaoundé Declaration, which was published a few weeks ago. to really try to have this thinking anchored not only in Africa, but globally and also in Europe. So thank you very much, and happy to
thank you very much,
take any
Kim.
questions.
And actually, I've seen that Harris has been sharing all these resources in the chat. For everyone having an interest into this, please consult this, because we see here a movement that is underway. Harris, from what we heard from you and Rim, it's almost a brain revolution that we could talk about. Let's see how we can capture that in the joint statement, because there is quite a lot to chew. But if you would single out, let's say, maybe a couple of recommendations or very concrete action points or starters that you would recommend from your perspective, and with whom, I mean, on which we could work together also to, as Rim was alluding to establish those bridges across the pond. Where do you see we could be starting?
Yeah, thank you, Fred. I think, to give you a couple recommendations, actually a wonderful article was published, I shared from the Swedish Brain Foundation just today, talking about moving beyond national brain health plans to national brain economy or brain capital plans, which would allow us as brain area stakeholders to maybe, as they say, crab walk across a few more sectors. Not just think about brain health plans in health, but to think about what does it mean in education, in industry, and environment. So I think it would be a great exercise, Fred, to work with you and everyone on the call to think about what would be a national, let's call it a national brain economy plan. And could we develop a toolkit that countries or sub-regions of countries could implement themselves in a way that's culturally and ethnically and whatever relevant to their economy. So that's one recommendation, is a national brain economy plan. I think that a European brain economy lab would be very helpful as well, which could almost coordinate this activity. We like to study systems change, and we've been studying a lot the Bezos Earth Fund, which is a $10 billion fund from Jeff Bezos that's all about human sustainability and planetary sustainability. And they have a wonderful systems change lab. And so we're exploring what do transitions look like in each sector, in health and education. Where are we standing with these transitions? Are they going forward? Are they stalled? What are the enablers and barriers? If we did this in the context of Europe, just again, a European brain economy lab, I think that would be very powerful, and would be eminently, I think, also philanthropically fundable if we were to do that. And that would just allow us to coordinate better and have an approach to that. As far as transatlantic recommendations, I think the Americans are very interested in collaboration. We were with John Nye, who runs the Brain Initiative, last week in Houston, Texas, at an event we did on the American brain economy. You know, the Brain Initiative in the United States has had some funding cuts recently, which is problematic. So working across with Europe, galvanizing interest in brain research and recognizing that brain research is foundational to this brain economy transition, I think is very high on the Americans' minds. And maybe the last thing I'll say is that we are, Fred, you and I and Rim, exemplifying transatlantic coordination at the United Nations Brain Days, which is coming up in New York in September. So we will have a mixture of American and European stakeholders talking about brain research. What does it mean to society? What are the opportunities and challenges with politicians, policy, community groups, patient advocacy groups, researchers all coming together. And we're delighted that we have the Cameroon government, which is leading the presidency of the UN General Assembly, to really guide us through that process. So I think we're well on our way to trying to forge more transatlantic partnerships. Oh, you're on mute, Fred.
On the part, yep. Sorry, Harris. I wanted to quiz you particularly on the Yaoundé Declaration, because you've been very instrumental in achieving that. How do you see that this declaration can actually spill over? And as Cameroon is now chairing the UN General Assembly, would there be a hope that this is spilling over into the UN agenda?
Yes, so the Yaoundé Declaration is called the Yaoundé Declaration for Brain Economy, Brain Health, and Brain Capital. And it is a wonderful document that we've co-developed with stakeholders around the world. It's African-led. And the idea is that it's been approved by actually the president of Cameroon, His Excellency Paul Biya, and is now going up into the Cameroonian presidency of the United Nations General Assembly. So we have this, I think this is historic for us all on this call as brain area stakeholders, that we have a declaration approved by the president of the country that is leading the UN General Assembly. So in New York, we will push this and see what can we do with it in terms of advocacy and resources and funding. But then it's key, Fred, that to recognize that the UN General Assembly presidency runs for 12 months. So how are we going to use this to engage in Brussels in policy discussions, to engage at the World Economic Forum, and to perhaps parlay into the G20 presidency of South Africa, which starts in December. So hopefully this Yaoundé Declaration is a big deal, but it's also just the start of trying to cross-connect to other governmental policy innovation opportunities.
Awesome. Well, thanks for these precisions. I'm afraid we'll have to move on with our agenda, but thank you very much, Harris, for making it live from the US, and thank you, Rim, for your perspectives, because you are really putting this conversation in orbit, and also opening up, let's say, the open daydreams that we can make with the outcome of this joint statement within the Thematic Network initiative. So I just would like now to come back to and move on to our next panel. But the aim was really to try and come back to what exists already and explore how we can leverage on current initiatives. With apologies, we have taken some degree of liberty with the program as it stands on your screen. And I would like to invite as a first contributor to this second half of our meeting, Marianne Taki from DG Sante, in order to give us an insight on the state of play with the NCD initiative and the Healthier Together program. So Marianne, over to you.
Yes, good afternoon, everyone. In fact, it was supposed to be Tim from RTD. He wanted to speak
That's
before
fine.
me.
I can call on Tim first if you like. But
I think we agreed on that. But if Tim is available, I think he is.
Okay, perfect.
He has the first.
No worries. We are amongst ourselves, so we can have that degree of flexibility. So happy to introduce you, Tim Ramakers from DG Research and Innovation. Over to you, Tim.
Hello, everybody. Thanks for the invitation. So I'm standing in for Catherine, who needed to go to an urgent meeting. So I'm policy officer in the Combating Diseases Unit at DG Research and Innovation. And let me just dive in. Oh yeah, wait, I have the controls here, sorry. Okay. So we've already had, from previous speakers, we've heard about the challenges and the urgent needs in the field. So I'll be very brief with our perspective. So because brain disorders are complex, multifactorial disorders, we need to clearly foster collaboration between multiple stakeholders. Researchers, clinicians, patients, industries, payers, regulators need to work closely together to address the challenges. And there's certainly room for improvement in collaboration. Another issue is access to research infrastructures and resources, and the sustainability of resources. And this needs to be improved too. So resources are not abundant, and we clearly need to capitalize on what already exists. So we need to also further structure the brain research area and ensure that all stakeholders work together in an efficient manner. And if we want to conduct impact-driven research in order to develop solutions that are needed, we need to involve those who are concerned the most, the patients and the caregivers. And we need to involve them in the full process of research, from concept generation to implementation and uptake of results. And just on the last point, Europe is very good at producing excellent research, but not so good in transforming the results into technologies and products. So there's clearly room for improvement there. So as was already said, as brain disorders are a leading cause of disability in Europe and worldwide, and because they pose such a great burden to patients, families, caregivers, and the healthcare system, brain research has actually been a long-standing priority for the EU. And despite the advances made, there are still many unmet medical needs, where also best performing drugs show modest efficacy and non-negligible side effects. So there are many challenges, and there's also the challenge of the rapidly growing impact of the aging population and simply the complexity of the brain. So more well-coordinated research and innovation is needed to deliver improved and personalized solutions for patients and healthcare professionals, as well as better evidence for policymakers. So the current framework program for research and innovation is Horizon Europe, and it started in 2021. And the program aim was to have more impact for patients, citizens, and society. And a novel push was to push for more synergies with other EU programs, like the EU4Health program, and there, for example, the Healthier Together EU Non-Communicable Diseases Initiative, which also has a focus on or a strand on the mental health and neurological disorders. And the next speaker, Marianne Taki from DG Sante, will go into that a bit. And then we also have the 2023 Commission communication on a comprehensive approach to mental health. So the program was co-created with a number of key partners and stakeholders. There were public consultations, there were consultations with member states, there were consultations with colleagues within the Commission and the different DGs, also for DG Sante. So Horizon Europe should lead to a more effective uptake of results for better prevention, diagnosis, and treatment strategies for brain disorders. So there are three pillars and a horizontal part on widening participation and strengthening the European research area. And pillar one is on excellent science. And this responds to the need for more basic research and improved access to research infrastructures. And here, the European Research Council has an important role to play. And it's a bottom-up way to fund frontier research. Then we have pillar two on global challenges and European industrial competitiveness. And this is aimed at improving collaboration. Then we have and I will go into a bit more detail on that very soon. Then we have pillar three on innovative Europe, and this seeks to boost innovation, replicating the success of what was achieved with the European Research Council, but then in the innovation area. And just to say, here the European Innovation Council plays an important role. And it funds mainly bottom-up research, but there are also top-down initiatives. And for example, in 2021, there was this Pathfinder challenge on tools to measure and stimulate activity in brain tissue. Now going into more detail in pillar two, this addresses as I said, this addresses the need to improve collaboration, and it holds the large collaborative projects. And this is needed because of the, obviously the multifactorial nature of the disorders and the need to have researchers from different disciplines working together. And a number of partnerships have also been funded under Pillar 2, and then a key public-private partnership is the Innovative Health Initiative, which is a key focus area also in brain research. And this IHI, the Innovative Health Initiative, goes beyond its predecessor and not only involves the pharma industry, but also the life sciences industry, so medtech, biotech, and digital industries. And the approach of having these sectors work together should accelerate the development of innovative products. Now, with the adoption of the second strategic plan in March this year, we have the launch of the public partnership, the Brain Health Partnership. Yeah, preparations are ongoing, and I'll say a bit more on this later. And Ulrike, in her presentation, will also go into more detail. But I just want to add that when we're talking about the Brain Health Partnership, it's this holistic approach to both mental health and neurological health. And I should just add that key partners of the new Brain Health Partnership are also the public-public partnerships, AeroNet Neuron. So this is the network of European funding for neuroscience research, and JPND, which is the EU joint program on neurodegenerative diseases research. There are also other partners too, but I'm not going to that right now. Sorry, wrong button. Okay, here you see a scheme of various EU funded initiatives with the timelines running centrally. And these different initiatives cover coordination and support actions. And we've had the EBRA CSA, which was led by the EBC, the European Brain Council. We have the ongoing CSA in purple on the top, brain health, which we'll talk about in a moment more. We have had a number of AeroNet co-fund actions, and top in green, the ones related to JPND, so the JP co-fund 1 and 2, and on the bottom, the Neuron co-funds 1 and 2. And then we also have the Future and Emerging Technology Project, FET project, the Human Brain Project, and its main output also being the eBrains, the digital research infrastructure called eBrains. And so just to say the CSA is paving the way to this Brain Health Partnership, which is expected to start at the start of 2026. The idea behind the new partnership is to put the existing brain initiatives together under one umbrella. So this includes JPND, Neuron, the Human Brain Project, and its output, the eBrains digital research infrastructure. And the aim is to accelerate the delivery of preventive, diagnostic, therapeutic, and care solutions to foster brain health in citizens and patients. We need to align efforts and funding from member states and associated countries in brain health research under one strategic research and innovation agenda. And this agenda should facilitate working together and achieving synergies so that we can deliver more ambitious results and have a greater impact. We need to capitalize on existing initiatives in Europe and bring them closer together. But at the same time, we should also strengthen links with other key entities like other relevant partnerships, rare diseases, Era for Health, and so on. And then other relevant infrastructures, the BBMRI, Biobank, patient advocacy groups, scientific society, citizens, and so on. And this initiative needs to have clear objectives and ambitious scope and goals. And member states hopefully will support it. And as it's about fostering the European brain research area, and there will, of course, also be EU funding. Now, just a few words on the CSA. As Ulrike's presentation will cover more on it, as well as an important note, which I would like to make at the end of this slide. So the CSA is paving the way to the partnerships. We've had a number of key meetings. There are certain key tasks to be delivered by the CSA, this strategic research and innovation agenda, implementation plan, governance structure. Ulrike will probably say more about the entity she works for, the project management agency of this German research organization. A draft proposal of the partnership has been developed. There's a strategic research and innovation agenda has been developed, and there's been a public consultation. And as I said just previously, we should aim for an ambitious budget and for an ambitious partnership like this one. And the note that I want to add is that, firstly, the partnership should work in tandem with the initiatives I'd mentioned earlier, like the Healthier Together initiative and the comprehensive approach to mental health. We have to really focus on exploiting the results. We have to really focus on maximal exploitation of the results and deliver impact. And the partnership, I should say, is very well placed also to deliver on the new political priorities, which our Commission President in July this year laid out in her political guidelines. And this includes also priorities on in mental health, in autism, and in degenerative illnesses. And lastly, I just want to mention that if you want to keep informed on our activities, please consult these websites. In March 2024, we had the European Research and Innovation Days with 3 sessions on mental health. There was the Horizon Europe Health Info Day in June 2023, and then another one is expected in May 2025. And recordings of the previous events are available if you'd like to see them. And yeah, thank you for your attention.
So thank you very much, Tim. That was again a very thorough overview of the pace of progress on your side within DG Research, as you alluded to the synergies and connections with the initiatives on DG Sante side. Marianne, I'm happy to give you the floor now.
Yes, good afternoon. Thank you, Tim, for giving the big framework. So first of all, thank you for inviting DG Sante to speak about the public health actions in the area of health and brain health. We all know that healthy brain and healthy mind are central to good health. And this is why finding long-lasting solutions to protect and promote them is so important. Let me start by describing a little bit what we are doing on mental health. Tim already mentioned the comprehensive approach to mental health. This was the biggest strategic framework that has been developed at the EU level on mental health. We presented it last year, and it is the cornerstone of the strong European Health Union that we are building. So it's strategic, and it's also very political. This comprehensive approach put forward 20 flagship actions, and they cover a lot of different topics and issues. They are, for example, on health promotion, improving mental health promotion, prevention, and creating new interventions and solutions, and improving access to treatment and care, and quality of life. We also want to strengthen gathering data and improving health information and knowledge. And finally, making sure that the health professionals across Europe and also other professionals who are working on mental health issues can learn from each other. For that purpose, we have launched a big exchange and training program. We have identified 1.2 billion euros in funding to back up all these actions. You may have seen that we have a tracking framework, which is pretty much a sort of a plan where you can see each of the flagships and how they have been implemented. We published it in May during the European Mental Health Week. The Brain Health Partnership is one of the flagships, and I think there was a question in the chat, and I think it's extremely important to understand that DG Sante did not do the mental health approach alone. We did it with 20 different Commission services. So as such, already it was very comprehensive, and we will continue to work very closely with colleagues. Now, in addition to mental health, if you look at non-communicable diseases more horizontally, of course, DG Sante has already experienced for more than 20 years for disease prevention and health promotion. Most recently, 2 years ago, we published a strategic framework to support our work on NCDs. It's called Healthier Together, EU NCD Initiative, and I was happy to see that some colleagues are also following from the stakeholder side, Healthier Together initiative work. It focuses on the sort of the main killers of Europe, or the main burden of disease in Europe, and that includes mental health and neurological disorders. It also addresses cardiovascular diseases, diabetes, chronic respiratory diseases like COPD, asthma, etc. And we have a horizontal strand on health determinants. And one of the key elements of this framework is also to reduce health inequalities across Europe, within countries and within regions, and between population groups. It was co-created with the member states and stakeholders, and for us, therefore, it provides the steer for actions to address these major challenges. Of course, the EU for Health program is the main financial support instrument, and we provide funding for national authorities, that is member states, and for civil society organizations to implement actions under the Healthier Together initiative. Now, focusing on neurological diseases, 4.5 million euros have been allocated from this EU for Health program to member states to collaborate on dementia and stroke. The joint action is called, I don't know how to say this, but it's called JADE. In Finnish, it would be JADE, and it is led by Spain. It will focus on dementia and to foster early detection through 38 different pilot or testing pilots and interventions across the EU. It will start next year, 1st of January. And then not that much money, but still 300,000 euros will support civil society organizations to develop practices that can be innovative for tackling dementia and eliminating stigma. Now, one of the colleagues, I think from the US, mentioned that aging population is a huge issue over there. It is also in the EU, and we will see major trends and impacts when the number of people over 65 will increase drastically in the future. They will need long-term healthcare and treatment, and of course there will be then pressure on healthcare systems, the health workforce, and economies and societies as a whole. So as you can see, there are a wide range of challenges. Brain health is of course one of them. We have also cardiovascular diseases. If you look at specific silo thinking type of diseases, and therefore the Commission supports a comprehensive approach that promotes health throughout the lifespan. So it goes from all levels and bringing together different actors, different policy areas, and different players, stakeholders, member states, to create supportive environments to promote healthy lifestyles and to create solutions and interventions on disease prevention from an early age to foster healthy longevity. This approach was discussed with the member states and Norway and Iceland at our last meeting of the Public Health Expert Group, which took place here in Luxembourg this year. There are two major joint actions I would like to mention because I think they have direct links to brain health. The first one is led by Norway. It's called Joint Action Prevent NCD. It's the biggest joint action we have in the area of NCDs with the EU funding of 76 million euros. And it aims to address the root causes of heart disease and other NCDs. So it has, of course, also benefits for brain health. And another one is on cardiovascular diseases and diabetes. It's called Chacardi, and it's led by Italy, Professor Onder. It has a budget of 53 million euros from EU, and it supports 21 member states to work together. And they have an impressive number of 142 pilot projects across Europe. And I really invite those working on health determinants related to brain health to look at these too as well. And then we have provided 7 million euros for different stakeholder-led projects on health determinants, again linked to brain health. And now finally, besides the work we do with the member states under the Healthy Together, the public health expert group with stakeholders through this health policy platform and so on, we also are addressing major risk factors such as tobacco, alcohol and diets through legislation and policies. Tobacco control policy and legislation is of course extremely important at the EU level. So maybe I stop here and I would be happy to answer any questions. I look forward to receiving the joint statement from the Thematic Network and to see how it fits into the future priorities of the next Commission on Public Health. Thank you.
Thank you very much, Marianne, not only for your contribution, but for this openness towards future interactions in building up the joint statement. We'll certainly be back with when the draft is taking shape indeed. Thank you very much for that. I'm afraid we need to advance into the agenda. I don't think there were any particular questions aimed at our speakers, but if you do, please log them in the chat, as everybody is quite eager to know more about our development. And of course, Joe, the summary of the event will be made available and you'll be further informed as we go. I'd like to invite to our virtual floor Ulrike Büssow. Ulrike is the coordinator of the coordination and support action leading up to the Brain Health Partnership that was mentioned by Tim. And Ulrike, I'd like to really thank you for participating to our event this afternoon. But also we are eager to understand what the Brain Health Partnership actually is going to deliver and how this can be, let's say, a foundation in order to expand further action at EU level. So Ulrike, the floor is yours.
Thank you very much, Fred, and thank you for inviting me. And just to clarify the title, so yes, I'm the coordinator of the CSA Brain Health, but I'm also with the DLR Project Management Agency, and we are running the health research program for the German government. And that's why they are asking us to support them and engage with European projects. And that's why we are coordinating this CSA, but also the network mentioned earlier by Tim, which is called Neuron. So next slide. We have heard a lot about challenges. The burden of disease is enormous. Medical need is very high. And there is a research gap. We have a knowledge gap there. There is also an implementation gap and an access part there. But what we're talking about now, and that's what also Tim was mentioning before, is the question about generating knowledge. And so we are now focusing in the next few minutes on the research and the development part. And you have seen, in spite of considerable efforts and investments in research and innovation in the last decades, effective prevention strategies and therapeutic options for mental and neurological disorders that are accessible for everyone are still lacking. So next slide. So you have seen this landscape slide also from Tim, and the important message here is there is a rather complex picture of different initiatives, and we have heard that on earlier comments from fans and also in the chat that they were asking us that the agencies, the funding agencies, the national ones and the national ministries of the member states should talk to each other and coordinate and align. And that's basically what you see here already. There has been an enormous amount of coordination and alignment in the past 20 years, also supported by the European Commission and their funding, where we all joined together and funded research. And we have been throwing around some numbers, and I can add some there too. So just these two networks which have been mentioned before, which is JPND and Neuron, they have published 39 calls and invested, and that means a public investment over 400 million euros. So this is already a huge effort. And what you see there is it's not only these two networks, there are others. There is an infrastructure part, which from the Human Brain Project and now from eBrains, there's a strategic part there. And this is all being channeled now into one joint action, which is Commission and member states promoted. So that means that we are doing exactly what has been asked before, that the funding agencies and national ministries from the member states are talking to each other, agreeing on joint actions, agreeing on joint programs and conditions, how to apply for them, how to evaluate, how to finance. So this is a huge endeavor, and we are already on a good way there. So this is what we are presenting here in the next few minutes. Next slide, please. So Tim already mentioned that there is a project which is called CSA Brain Health. So we are basically the preparatory phase for the European Partnership for Brain Health. And the most important part, what we're doing in these months, we started last year, and we are having this year and next year to prepare further, is the most important part is to develop a joint research and innovation agenda, because this is the tricky part, no? To get everyone and all the funders which are there together with patient representatives, with the research, to get them all together with a private sector, and to come up with a relevant research and innovation agenda, and to come up with a governance structure which is really working, because the scope is enormous. We had these comments already in the chat, but also from Tim and others, that what we are looking at is the scope which is across the entire area of brain health. So we are doing exactly what has been asked also in the chat, that we're not talking about single indications or a group of indications, but we are talking about brain health within a holistic approach. So that means we are basically asking for a very broad scope here. And to keep that efficient, we need a good governance structure. And that's what we are developing at the moment, and also the work program around that. So that means dialogue. And that's why we're partnering also with EBC in this endeavor, dialogue with the stakeholders, patients, citizens, society, private sector, and global partners. And the overall idea is to create a brain health ecosystem to enable broad discussions in the preparation for this partnership. Next slide, please. So this is what we are looking for. The cornerstone of the current project is the development of this agenda for research and innovation. And just to some food for thought, what we are looking here is a lot more than happy workers, to be a little bit provocative, because the perspective of families living with dementia is completely different from the perspective of a maybe not so happy worker. So obviously there is prevention in there, but it's prevention for brain disorders, and it's promoting brain health. Yeah. So because we are looking at a situation where we have limited budgets, and we need to convince the ministries and the member states here to invest into these kind of endeavors. And so what they are looking for is impact, as Tim also mentioned. So the priority one is the ability to comprehend, prevent, and treat disorders affecting the brain and sensory organs. And that really fundamentally relies on the understanding of the mechanisms. Yeah. So there is what also has been mentioned by FENS, to create a knowledge base there. And the challenge is here to build on improved understanding of the brain development and its functioning. Priority 2 is understanding the pathophysiology and identifying the mechanisms underlying the brain disorders, so that we are really able, and that is basically what I mentioned before with the knowledge gap there, that we're really able to develop diagnostics which are precise, which characterize appropriate time windows for interventions, and to select or combine appropriate and effective therapeutic interventions. Priority 3 mentioned in the agenda is improving care and support for people living with brain conditions and their caregivers. And that requires a comprehensive approach that encompasses research translation into clinical practice. And that is one of the hurdles I would be mentioning as the important part when you ask me what is the take-home message there. So the aim is to bridge the gap and accelerate the translation between research and practice, especially clinical practice. And for that, we need to involve patients in the research process and to get really tailored interventions in care which are tailored to their needs. Yeah. Priority 4 is the aim to promote research in social sciences and humanities research to better understand the impact of what we are doing there. So the societal, the socioeconomic, as has been discussed before, but also the cultural, legal, and ethical determinants of brain health across the entire lifespan. And that means individual, psychological, social, and environmental factors included there. And that is not only looking at the disorder part, but also which of these are promoting resilience and brain health. And when we are looking at these kind of priorities, what we have also developed is a portfolio of transversal priorities, which are instrumental for the implementation and reaching these kind of objectives. So this is translation of research results into market. So there is innovation part, but also data harmonization and access, patient and public involvement, and again, the ELSA aspect of brain health research. So this is absolutely vital to bring research results into praxis and for that generate tangible impact for societies in Europe and beyond. Next slide, please. So what we did, we developed this kind of scientific research and innovation agenda with the experts and our stakeholders. And then we started a public consultation, and we're really happy, even though it was summertime, that we received many, many responses. Also from different sectors, which is very important for our further analysis of the results. And as you can see, this was also from the geographical spread. This was really fine. So we are happy to have now an agenda which is validated also by our stakeholders. And we are now starting the discussions with the ministries and the funding agencies, which of these priorities can be implemented with which kind of instruments. So that is basically the work what we are doing in the next month, coming up with a proposal for a work program and starting the governance discussions with the ministries, and then hopefully start 26 with the partnership. Thank you. The next slide, the very last one. If you need more information, there you can have the web page and contact us with the team.
That's where to find you.
Yeah, where to find us, exactly.
Super. No, thanks a million, Ulrike, and thanks for this explanation on how the partnership is going to be holistic, but also impactful and across the board. So, and I like the way by which this is responding to what we were saying in opening this workshop in the knowledge generation, but also in the way by which we can improve outcomes for people living with a brain condition. So we can certainly come back to this in the course of our discussion. But before opening it up, we wanted to give also the floor to less institutional initiatives, but more stakeholder-based or stakeholder-driven partners. So I know that Professor Bassetti has an issue with timing, so I would probably invite Professor Mika Martikainen first, who is the president of the Finnish Brain Council. And Mika kindly agreed to join us in order to provide an insight on the progress made in Finland and the ways by which the brain agenda is on the move. So Mika, over to you.
Thanks a lot, Frederick, and very happy to be here. Thanks for the organizers for inviting me and giving the chance to tell you something about what we've been doing in Finland and some also thoughts about how to proceed. So my name is Mika Martikainen. I'm working as professor of neurology at the University of Oulu in the north of Finland. I'm currently the chair of the Finnish Brain Council. I'm also the vice president of the Finnish Neurological Association, which is the professional organization of neurologists in Finland. So obviously this is a bit of a repetition regarding things that we've been hearing from many presentations this afternoon. So we are also approaching in Finland this the whole in a way of neurological and psychiatric or mental health issues and taking the perspective of brain health as a whole and brain health of individuals in a society which I think is obviously a very important perspective. And there you see some of the frameworks and some of the plans that have been published already for the purpose of developing our ways to enhance and foster brain health and healthy society. So the mental health action plan of the WHO, the IGAP by the WHO, and the optimizing brain health program. And I think we're also in Finland, we're very heavily relying on the framework laid by EAN for the brain health strategy, which is I think a fairly nicely presented comprehensive program on how to approach brain health of individuals in the society. Moving a bit forward, so in Finland, there are actually partly because this is obviously a very common theme and important. There are important stakeholders that have been approaching these issues for several years. It's actually we have several important people and organizations that we try to align and get intimately working together to develop a common approach to brain health in Finland. So let me carry you through this in the following. So the national brain health program that was launched in 2021 was actually launched by Aivoliitto, the Finnish Brain Association, which was formerly the patient organization for stroke and aphasia patients that now is under a different name. And the program that has been developed here is very much oriented towards a sort of positive understanding of brain health and brain well-being. It has an emphasis on protective factors, ways to enhance brain health of working age people, of children, adolescents, things like sleep quality, and I think very important things, and obviously as we heard from presentations before, things like healthy economy or economy that's positive and good for brain health, and on the opposite side, possibly things in society and an economy that might be detrimental to brain health. I think these are very important issues which have been brought up by this program. But I think there are also some other things which are very important and that have been possibly lacking a bit in this approach. And then this is why we at the Finnish Brain Council are trying to develop. And actually, the Brain Association is a member of the Finnish Brain Council, so they also on board in the Finnish Brain Council, which is a joint organization by scientific associations, patient organizations, and also other stakeholders and that are interested in promoting brain health in society. So we're trying maybe to move forward to the EAN style of a more wholesome, comprehensive approach, where the positive health is one thing, but there are also other very important things to remember and take on board. Neurocenter Finland is a collaboration of neuroscience experts, universities with medical faculties. The Wellbeing Services Counties is the framework of the public healthcare system provision in Finland, in the current framework, and essentially this is about university hospitals that provide the tertiary level healthcare and also medical research, medical education that are involved in the Neurocenter Finland, and all these parties are involved in developing strategies and ways to promote brain health for us. So in this framework, we as said, we are trying to develop a comprehensive program in line with the outlined EAN strategy. As in previous presentations, I would very strongly agree that research on both healthy brain function, physiology of brain function, and also on brain disorders, the pathology, pathophysiology, development of brain disorders is of foundational importance. Without very strongly research-based and science-based approach, I think it's very difficult to reach the goals we are trying to reach. I think this also applies to all positive health approaches and brain economy approaches. I think it's very important that we strive to gain research basis and evidence base for all these approaches, so that we know that we can deliver what we speak for. Prevention, diagnostics, treatment, and also rehabilitation of brain disorders is very important. So we know that despite all the efforts we can put on prevention, unfortunately, there will still be people who will suffer from various mental health or brain conditions. And I think this is something we have to keep in the focus very much to try to work very hard on developing ways to help people with and families with these issues as much as possible, and as we know today, to develop better ways to deliver treatment and early diagnostics. Also, not to forget the positive brain health approach and window, sort of speaking to brain health, well-being in society, creating better working life, creating economic framework to support healthy brain in society. This is obviously very important as well. On societal and political level, I think it's important, and what we are trying to do, and the EU campaign now with the EBC was one of the very good example of steps taken to this way, to promote changes and efforts in social policy, education, legislation, economy, to foster better brain health for everyone. So we are very late in the session, and I try to keep this fairly compact. So this is basically all I had prepared for this afternoon. I'm very happy to take questions, and I thank again for the possibility to speak here today. Thank you.
Thank you very much, Mika. That was a very nice example, and thanks for making it. Actually, I'd like to stay with you, and maybe if in a matter of less than a minute, can you give us an idea as to what benefit you would see in developing such an EU coordination plan, as we are calling it?
Well, I think one of the important things is that for the first, I think research, efficacious and very high level, top level research in brain disorders and brain function, that has to be international. It cannot be today. It's not possible to do it in every country by themselves. It has to be very international. There is need for EU level funding for very top level work, and I think that's one of the things why this is important. Another very important thing is that with, I think in Finland, the government is struggling with the economy and struggling with the money. I think this is the same problem for unfortunately for most of us in EU, and I think it's easier to put pressure on governments when there is an EU level consensus and top more from the kind of the joint EU level agenda and agreement on the importance of brain health. Because if we all have to work separately in our own countries, there is less pressure for the politicians, and there is more risk that we don't have the pressure and the voice to speak for these issues as we would like to have. Maybe a third thing is that also I think I'm also active in the ERN framework for the rare disorders treatment and development of care in Europe. I think it's very important also for the patients to in a way that we develop ways of international care and gaining the expertise and knowledge from the best experts all around in Europe, and also for this level, I think EU level collaboration is extremely important.
Awesome. Thank you very much, Mika. And actually, you're giving me a few discussion points, maybe Ulrike, that I can share with you about this international dimension and the value. How do you see? Obviously, you've explained how you saw the partnership to take shape, but do you see a potential of it to be really anchored into this vision of a broader coordination plan and broader initiative as we have been discussing so far?
Yes, definitely. As I said before, there is a very, very broad scope of the brain health partnership. So there is a way to anchor that. But it's also, I was mentioning that to manage expectations, because it has to be really clear. And I'm here completely with Mika that this partnership is running with EU finance and member states budgets. So we need to convince the member states to invest here. And that's exactly what we're doing at the moment. It's basically a roadshow we are running here to convince the ministries and funding agencies to invest. And for that, it's critically important that we can demonstrate impact. And that's why I was saying earlier, now we have to show that we're really tackling the medical need we are seeing here. And I'm also with Mika for the funding part. What we are looking for is to secure long-term funding. And this is the first time that we are looking for a funding stream, which is with a perspective of almost 10 years there. So this is unique. And it's also unique in this funding landscape that we are looking for a partnership which is just dedicated to one organ. So if you look for the other instruments which have been mentioned by the Commission, these are a lot broader. There is pandemic preparedness, rare diseases, personalized medicine. This is a huge scope. And here we have the possibility to make a difference. And what we're looking for is to create a basis for the researchers to focus on what is creating impact. And that's why I was mentioning this research innovation agenda, because it's really generated based on the feedback of the experts here in the field. And what is our goal here is, and that is maybe the second take-home message here, is what we need to have there is to support collaboration in such a way that the researchers and experts and clinicians are sharing data, and that they are harmonizing the data in such a way that we are able to analyze across the sectors, that we're not only having research data, but also implementation, real world data, and really understand what's happening out there, and thereby generating impact. So that will be my both take homes there is secure long-term funding and support collaboration by sharing and harmonizing data.
Awesome. Thank you very much, Ulrike. And obviously, Tim and or Marianne, I mean, I'd like to invite you if you have any more comments, because we are now entering into the space of, is it convincing for civil servants? Is it convincing for policymakers? Is it convincing for governments? I know we could talk ages about that, but in a minute or so, if you have a sense of, are we going in the right direction with this endeavor? And I don't know who would like to start. Marianne, are you okay? Can I invite you?
And I can say a few words. So thank you very much for all the presentations. I'm very happy to see Mika from Oulu as well. It's always good to see a co-patriot when I'm alone here with all these commission EU autocrats. Now, in terms of I don't have advice for lobbying. We're being lobbied. I can only tell you that a lot of people are lobbying us. So that's why I tried to say in my intervention that comprehensive approach on prevention is something that sells right now. It's because I have every week meetings with now brain health. There's also liver health, the Friends of the Liver. There's so many organizations and organs and diseases. And I think that what I try to say to everyone, also for respiratory people who are lobbying for those patients, is to join forces. I think this is the only way anyone can survive in today's world on any topic. You need to network, and I don't know how these thematic statements are done, but it's something, of course, very important because you were selected out of many. So I think you have a very good opportunity to explain why is it important, how it's important, and what can it do. So keeping it very focused and practical. There were a lot of great ideas, and I love to hear from the US colleagues what they are doing there. But keeping in mind the pressures we have in Europe, member states, Finland, economies. I mean, the reality is reality. So it's really what the political parties of the member states are, what they will be by the Commission, what they will be by different, universities and so on. It's a very complex picture, but I think brain health is there to stay. Keeping in mind, of course, that mental health people and mental health lobby organizations and patient organizations think that it should not be sort of mixed with the neurological disorders. So I think there's a way to go, but the key is to network and to have a common message from the stakeholder world, because there's so many needs and so many challenges, and we really need to tackle those where we can have most impactful actions. But I think that's where a team comes into picture, because they have lots of money in research.
Thank you very much, Marianne.
Well, I mean, I can just only echo what Marianne said. Basically, the need to sufficiently collaborate and integrate not only this public brain health side, the research side, and all the other actors, and then come up with this agreement on this joint priorities, and that's really good for communication and awareness raising, and this way you can realize the goals. They're so ambitious. And just to come back onto the research side, it's really, really important to exploit the results, identify the practices, the promising practices, and get it into the clinical practice or in other areas. So, I mean, I just wanted to emphasize that point.
Thank you, Tim. And indeed, that resonates very strongly with the various elements of the conversations that we have had today. We are slightly beyond our end time for this webinar, so it's probably time for us to bring it to a close. But I can only do that by thanking you all for contributing today, for your time, but also for these thorough presentations and sharing of perspectives. It was very helpful in us collecting this input in order to go ahead with drafting a first proposal for the joint statement. We have had really a handful of these perspectives coming from the patient community, the scientists, but also experts providing us with this kind of a broader vision. And with our concluding panel, I think that we are already making progress in connecting those different dots, and more is going to come. So as I said in the introduction, the consultation is now open for any inputs you would like to provide within the audience. So please be in touch, use the platform in order to do so, as this is the structured way of dialogue in us going ahead. And we can definitely invite you to pencil the 24th of October within your diaries for next occasion to have this type of interaction. So wishing you a great rest of the day, and many thanks again for all of that. And we look forward to seeing you on the next occasion, 24th of October, as well as the 26th of November for the conference. So have a great rest of the day, and looking forward. Goodbye. Thank you.